What about pediatric emergencies? If you could just tell us something about emergencies that happen in children, for a common man, how to understand that or grasp that, and then what is the approach that the common person should have when it comes to approaching the doctor?
Okay, so there are multiple pediatric emergencies. Like if you say the newborn age or an infant age, your pain is an emergency. The baby will cry his heart out. Colic is kind of emergency. So emergency, not that you have to rush to the hospital, but it is like a panic situation to the parent, because you see your 4-month-old child crying like crazy. It could be colic, it could be your pain. They can't speak, they can't express, you don't know. So if your doctor is well versed, you are in touch with your doctor, and the doctor is your pediatrician is approachable, it is very effectively you can treat the symptoms like colic or ear pain. If they fall, there is an injury, there is bump, the parents get panicked. If they have like cuts and all, these are very common superficial things. But yes, deep things like very severe abdominal pain. Now in kids it is not very common, but in the child age 1 to 5 years, I have seen few cases of severe abdominal pain. So when the abdominal pain is very severe, or it is not severe but frequently happening, not reciprocating to the remedies given, you have to investigate them, do a sonography, do a plain x-ray abdomen. Intussusception is one of the very common things happening in children in 1 to 5 or 1 to 7 years of age. So it sometimes presents with very severe pain depending upon the grade of intussusception. Sometimes it presents with only nagging pain, and the patient has very nagging pain and nausea in the morning. The mothers will relate to कि school nahi jana hai. Maybe the kid wants to feel the sickness, or maybe in the morning it's just the anxiety to go to school. So we give them medicines, but if they don't get better, you have to keep all these things also in mind. Intussusception is the intussusception of intestine, it is an surgical treatment, so you have to refer to the pediatric surgeon or the allopathic pediatrician. So that cannot be handled with homeopathy, because it is obviously the surgical condition. So conditions like this we see where you have to be, I think every homeopath or pediatric homeopath has to be open to referring cases or referring children to the specialist as and when needed.